Morning. Good morning, everyone. I think we'll go ahead and give it one more minute. We're still waiting for one of our panelists. All right, perfect. He has joined, so we can go ahead and get started. So welcome to today's Rollins School of Public Health alumni panel, Pathways to Public Health, Alumni Working Abroad. My name is Amy Parker Feibelkorn. I graduated in 2005 from the MSN MPH dual degree program, and I am currently the adult immunization team lead at the Centers for Disease Control and Prevention. I'm joined by two other moderators, Molly Guy. She's also an MSN MPH graduate, class of 2005, who is the Senior Director of Clinical Transformation at the United Health Group, and Elena Dordnoff, MPH class of 2020, who is a public health consultant at J. Michael Consulting. So we're the three moderators for today's session. We are fortunate to have three alumni representatives from Rollins School of Public Health with us today. And at Rollins, we are incredibly proud of the contributions of our alumni and everything they do to advance public health. While many of our alumni remain in the United States, nearly 1,000 RSPH alumni are living and working internationally. The purpose of today's session is to highlight the amazing career paths that three different alumni have taken after graduation that landed them in public health positions abroad. So before we introduce our panelists, I just want to mention a few housekeeping items. So today's session is recorded. So if that is an issue for anyone on the call, please feel free to drop now. And for today's podcast-like session, you may type any questions into the chat as we're going along. After the panelists have finished their discussion, we will open it up to the audience and ask the panelists questions that have been entered into the chat.
So we would like to introduce our first panelist, Marina Laura Fernandez. Marina graduated from the EPI program in 2010 and is now living in Cordoba, Argentina, working as an adjunct professor of epidemiology and statistics at the Instituto Universitario de Ciencias Biomédicas de Cordoba, and is pursuing her PhD. Our second panelist is Dr. Muhammad Zia ul Haq, who is a Fulbright scholar. Dr. Zia is a public health expert with a focus on epidemiology. As a fellow at the World Health Organization Regional Office for the Eastern Mediterranean, Dr. Zia has been instrumental in implementing health initiatives and fostering collaborations. His background includes working with the CDC Foundation and conducting research at the Morningside Center for Innovative and Affordable Medicine. Dr. Zia is a dedicated advocate for diversity and inclusion in public health, and he earned his MPH in epidemiology from Rollins in 2021. Our final panelist is Heather Monet. Heather is an external relations officer and gender lead with the Global Polio Eradication Initiative at WHO. Heather has been with WHO for over 20 years, working in the areas of international relations, public health, gender, and resource mobilization. Specializing in managing relations with governments, philanthropic foundations, and NGOs, Heather oversees a donor portfolio of over $5 million US, as well as spearheads gender mainstreaming for the Global Polio Eradication Initiative. Heather's a former Fulbright Scholar and Global Health Leadership Fellow, and she earned her degree in Health Policy and Management from Rollins in 1998. So welcome, panelists.
I'm so excited to learn from you all. So I just want to thank you so much for this opportunity. If it's all right with y'all, let's go ahead and start with Marina. Please tell us about your journey since Rollins and how your time at Rollins influenced your return to Argentina.
Hi, thank you for inviting me. Good morning, everyone. After completing my MPH, I finished my MPH in 2010, and I work as a clinical research manager at Connecticut Children's Medical Center in Connecticut for 5 years. There, I oversaw all research projects in a gastroenterology practice. Following that, my family and I relocated back to Argentina, where I became a professor of epidemiology and statistics in a new school of medicine. Also, I had the opportunity to keep working in a research lab during that time. My time at Rollins, you asked me, influenced me in a really positive way. I felt prepared to train others in the same manner that I was trained there. I aim to equip my students with knowledge all the current public health issues and situations and give them the skills they need to solve related problems. For me, it was a great opportunity and a way of giving back to them.
Giving back is so special, and I'm so excited to learn more from you today. Now I'd like to ask Dr. Zia about your journey and how Rollins shaped your current career path.
Well, thank you so much. First of all, I'm really happy to be here today. It's always a pleasure to connect to people from Rollins. If you can just let me know if you can hear me fine. Awesome. Yeah. I mean, my journey at Rollins was truly transformative. You know, I came here as a Fulbright scholar, and it was actually my first time going outside my country and, you know, just going anywhere to study, which was, you know, a really interesting opportunity to learn from so many people. You know, personally, I think the best thing and the most important thing that Rollins did to me was that I discovered the power of embracing my unique background. And I learned that not despite of, you know, who I am, but because of who I am, I can make so much difference. And you know, Rollins taught me to embrace myself. I formed really strong relationships. I led 2 student organizations. One was a Muslim community organization. One was an organization that advocated for the essential medicines at Emory with many other wonderful students. I also joined the Diversity and Inclusion Committee in epidemiology, where we, you know, advocated for the inclusion of people from different backgrounds. Rollins essentially provided a very supportive environment that allowed me to grow and confidently participate in public health discussions that can be very complex. Additionally, I would like to say that Rollins encouraged me to step out of my comfort zone and engage in applied practical experiences. I made valuable connections with the professors, peers, which led to incredible opportunities such as working with the CDC Foundation. Rollins also ignited my passion for cardiovascular disease. That was especially after my father passed away while I was still a student at Rollins, and that inspired me to become a cardiovascular disease research scholar. Through many wonderful classes and collaborations in the research with the international faculty, I delved into the public health issues. And, you know, one thing that I really loved was I was able to get involved in the research throughout the world. You know, I've been always inspired to do research in the South Asian populations, and I got the opportunity to do that at Rollins. Thank you.
Amazing. Thank you so much. I do think public health is so vast and broad. So all of our unique individual experiences and what we can bring to the table really just emphasizes that. So I'm excited for everything that you're going to do for the public health arena moving forward. Finally, I'd like to hear from our third panelist, Heather. How did Rollins shape your current career trajectory?
Right. I think I'd just like to start off, how did I get to Rollins? And my path to Rollins was a bit like this. I think as many people in public health field, we dreamt of being doctors. And I was enrolled at a pre-med program at my undergraduate institution. And actually my med advisor sat me down one day, my senior year of college, and said, "You're going to make the worst doctor ever." And of course, he just burst every bubble I ever had and, cried. And he said, "But I think you should do public health." And I said, "What the heck is that?" And so he gave me a list of schools to look at and in different areas and said, "This is really where you need to go, not be a doctor, be a public health advocate, work in public health." And so actually that's how I started to look at public health and ended up at Rollins. And I think one of the things that Rollins did for me, of course, and my other colleagues or panelists had talked about, is the engagement with the professors. My professors at Rollins really embraced my broad and diverse background. I'm actually a German literature major, so my undergrad wasn't just in a healthcare field, and sort of figured out how I could bring, my ability to speak German with my passion for healthcare. I think the coursework gave me a really solid foundation for me to be able to engage in resource mobilization in public health, because I actually understand what I'm trying to sell to donors. And lastly, I think the reputation of Rollins is incredibly instrumental. We are so blessed to have been able to attend an institution that has given us not only a solid academic background and access to amazing professors and public health leaders, and then just our colleagues, the students, our fellow students.
Thanks, Marina, Heather, and Dr. Zia for sharing. We hear from many of our alumni that many are navigating mid-career transitions and are really trying to think about what does it mean to be a global health leader. So Marina, we'd love to hear from you. How did you decide that a PhD was something that you were ready to explore?
Being a mentor is something really fulfilling experience, and I'm enjoying doing that. But after the pandemic, we were a year working home, and I felt I was ready and was the time to move on and to finish my formal education. Luckily, in my institution, we have a PhD program in biomedical science that accommodate full-time students, full-time employees. So I'm able to keep working, and at the same time I'm doing my thesis with one advisor from the institution. So that's something that will help me in further opportunities and leadership opportunities and other positions that I'm looking forward, it might be in the next 5 to 10 years to reach.
Thanks, Marina. And Heather, as you talked about your experience, you've had different roles and different opportunities. How have you been trying to grow as a mid-career leader?
Yeah, I think, I started at WHO as a Global Health Leadership Fellow, and leadership is something that I've really strived to ensure that's been a part of my professional journey, regardless of whether I was working in resource mobilization or external relations or gender. And it's really been a woven throughout my career. And now I'd really like to take that, all my own knowledge and experience to the next level. So I'm actually currently looking at doctorate degrees that focus on strategic leadership, which is really about innovation and transformation. And how do you push the envelope and sort of lead the way? And I think really focusing on affecting change. Many of the institutions of public health can be quite stagnant, and we need to be constantly evolving. And I'd like to, help not only WHO, but other public health agencies really sort of change. The post-COVID world has drastically affected how we design and deliver public health. And I think those institutions also need to change as well.
Thanks, Heather. And Dr. Zia, we appreciate you sharing with us, even in your introduction, some of the things that have shaped some of the different pivot points or transitions in your career. Can you share with us a little bit more about your experience and how you've made some of those transitions and how you've made those decisions?
Absolutely. I think I've learned some really important lessons while doing some mid-career transitions. And, the top of the list are really resilience and openness to different opportunities. Just a couple of years before now, I could not have imagined myself being involved in so many projects, which are so much like unrelated to each other. But if you look at them, from the importance standpoint, they are very important because cardiovascular disease research does stay my primary area of interest. But I worked with projects on the artificial intelligence. I worked in creating a trauma care app in Pakistan, which helps people triage and self-educate them about the trauma. I worked at WHO in the Eastern Mediterranean Regional Office, where I've contributed and learned so many things in so many, about so many conditions. I've practiced some skills, and I've learned so many lessons from people across the 22 countries that are headed by the Eastern Mediterranean Region Office. And just recently, actually, I've been involved in a project of some of the physicians groups here at Emory, who are trying to bring some innovative healthcare solutions, technology-based solutions to make healthcare more efficient, so that the physicians are able to spend more face-to-face time with the patients. Because nowadays a lot of time of the physicians and nurses just goes to sitting on the computer and just checking the messages and the alerts and so many things, especially after the COVID-19 pandemic. So that is a project that is very interesting. I did not have a lot of technical background in that, but still, after I've been working with them, it has been a very productive and very rewarding experience. So I think just being open to the possibilities is something that has really rewarded me, and has also taken me to so many countries like Egypt. I've been to the pyramids of Egypt, which was wonderful. So yeah, that was great.
Thank you.
I'm curious how you all deal with the possibility of failure. So you're talking about getting your PhDs, one in a more hard science aspect, one in a more leadership, mentorship aspect. You're talking about building applications and traveling internationally to places that you are unfamiliar with. How do you guys cope with failure or that possibility? I'll let any of you start.
Well,
I think, sorry, go ahead.
Sorry,
please,
Sia, go
Maria.
ahead. Sorry, Sia, go ahead.
All right, yeah, I can go ahead first. Yeah, I mean, it's sort of that's a really interesting question. I mean, it sort of reminds me during my 10th grade, I was reading about a very famous medieval scientist who discovered sulfuric acid because his experiments failed. And that was the reason it happened. So I think failure, I've discovered over time that it's a part of it's a part of the success. And just some of the opportunities that I've received were some of the wonderful opportunities were because I failed to get into something that I wanted, and instead I took something else. So I think just failure is like a redirection sometimes from my standpoint. But Marina, please go ahead. Thank you.
Yes, no, I think the same as Sia, and failure is part of life and what makes you grow and take some way and leads you to some way and not to another way. And you need to learn to deal with failure. I don't think any of us is straight to success anytime. Even in my classes with kids, and each group is different, and sometimes I use the same approach and doesn't work, and you need to try something different in a different way because it's a different moment of life for them and for me personally. So it's a constant working and trying to improve whatever you are doing at the moment.
Yeah, I couldn't agree more with Sia and Marina. I think success is a journey, and you're always going to have ups and downs and lefts and rights, and it's never a straight path. And I think that as they've both pointed out, there are so many things that you learn along the way. And actually your failures do lead to successes when you embrace them. And I think that's really important as well. And I think, one of the things that we've probably experienced at Rollins is that sort of that growth mindset, and learning from our experiences and learning from what our classmates and professors have brought to us. And like I said, I mean, I thought I was a failure. I wasn't going to be a doctor, but I ended up in the world of public health, and it's been one of the most amazing things I've ever done. So,
Yeah.
Elena, Elena, I love your question around kind of failure. And I think another thing that we often hear, I think today we have students and alumni at various points in their student journey and their career journey. And I'm curious for the three of you, thinking back to kind of walking across the Rollins stage on graduation day. You've all had very different experiences. You've learned different things. Kind of what is that one thing that you wish you could tell yourself that day that you were walking across the stage?
Well, I guess I'll start. 20 years later, I think it sounds a bit cliche, but to embrace opportunity. It's so easy to say, but it's so difficult to do. And I would just tell myself as a young person walking across the stage that, as hard as it may be, really embracing the opportunity is the best thing you could do for yourself. And I think I listened to my mentors, and I pursued a career where I had zero experience. I didn't have any experience in resource mobilization. But like I've said, it's been life-changing and life-affirming. And I think really, again, cliche, embrace the growth mindset, but really do. It's as hard as it is, it's going to be the best thing you could ever do for yourself.
Yes, and the same time, and for me, like thinking back in 2010 when I graduated, I never imagined I will be here at this moment. So imagine you can do it. You will reach there. Maybe it's not next year, maybe not in the next 5 years, but you will reach there and it's going to be okay and you can do it.
You guys have given me,
build on, what the two other panelists said. I think I would just like to say that, I would like to tell myself that, networking is very important, because it can be intimidating to reach out to people, or, sometimes just making a connection, even with the colleagues, even with the friends. It looks like, sometimes it could be too casual or too unimportant, but, over time I've realized that none of the connections, none of the conversation is too casual. Everything is important. One of the really wonderful opportunities I got, which was working at the CDC Foundation, was, just because my colleague from Rollins introduced me to that, and I just met him for just having a tea together, and this is how we introduced each other. And over time, one thing led to another, and he had this opportunity, and he just put a good word about me. So just really, I think networking and just putting yourself. So that's what I think is important to tell myself at the Rollins stage.
I am so glad, Dr. Zia, that you brought up networking, because it is so hard to push yourself outside of your comfort zone and make that effort. And yet so much of life happens from those sidebar conversations and, from taking the opportunities when they present themselves to have those discussions and out about opportunities in life and meet the right people who end up being pivotal, for future steps in your careers. So I really appreciate you taking a moment to talk about that.
And I also, can I just build on that?
Yeah.
I think it's also a part of leadership. Networking is one of the key tenets under leadership. And as we've talked about, being public health leaders, the ability to network is really, really important, because that is how we expand, our reach is through engaging through different networks that we've created. And so it is really, really a critical skill. And I think we got some of that at Rollins. And as you've heard from all of us today, we're still continuing to build those networks and that skill.
Yes, absolutely. It is one of those softer skills that isn't always appreciated in terms of the leverage and the importance that it can have on the pathway for each of our careers. I'd like to shift a little bit and talk about the role of mentorships. And, growth throughout one's career is often improved by having really strong mentors. And Dr. Zia, what are some ways that mentorship shows up when promoting diversity and inclusion in public health in your day-to-day job?
Yeah, that's a wonderful question. I think diversity and inclusion are, just very crucial to the success of the public health. And just especially, my time at WHO has been very sobering for me to understand that, just giving space to non-traditional voices and actually encouraging the people and the voices and, the sectors that are not well represented is just literally the basic job that we have to do. And, just recently, some of the countries in the region that I'm working at, Turkey and Syria, were hit by a very serious earthquake. And you have to understand that this part of the world is already suffering from so much. There were already conflicts. There are some areas where no one can reach. They're like sanctioned areas. There's just so much going on. And it's easy sometimes to sit in really good offices and just do work in developed countries and just present research and talk and all that. But actually going to in ground and making difference, it might not pay you as well as just develop in the developed countries. But I think it is much more rewarding, and it is much more needed to be out there and just work on the sectors that in the mainstream. And that has been something that really showed up in my experience working with the WHO.
Oh, that's wonderful. Thank you. And Marina, being in academia and as a professor in Argentina, how do you find being a mentor to public health students in your specific settings? And what are some unique needs in providing successful mentorship internationally that you've encountered that you would not have otherwise encountered working in the US?
Well, that's a wonderful question. Being a mentor to public health student in this setting that I'm right now is incredible, fulfilling and rewarding experience. Argentina, like I said before, has a rich academic tradition, and public health is a field of study that is becoming increasingly important, more important in our society as in the rest of the world. As a mentor, I'm able to work closely with the students. I'm in the classroom and helping them to develop their knowledge and skills in the field of public health. For example, and about pandemic, I talked before about what was a pandemic, and it was really hard to them to understand. And now we have, of course, the example of what's happening and what's tried to analyze, and that was really rewarding to show them and to make them to understand and give all the skills that they need to analyze the situation. Also, I'm able to help them through the process of conducting research. Remember, like I'm teaching to a medical school, so the mindset is a little bit different. I'm bringing them to the public health research and public health related fields. So I'm constantly pulling them in the other side. So that's really great, and I enjoy doing. But I'm in Latin America, and I'm Cordoba, that is it's not the capital, it's a countryside. So here we have different situations and cultural barriers. We have students from all Argentina. Economical situation is very difficult. Sometimes lack of access. So you need to deal with other stuff that teaching in the US will not be the case, but showing them that it's possible, they can reach them, there is opportunities, show them the opportunities, and show them that we can do nice things here too, and we have all the skills to do that.
Thank you. Yes, it's such an important role to build up junior staff and students and help them recognize their own strengths as you build the capacity of future leaders. Heather, let's turn to you. Can you talk a little bit about skills needed to manage relations between key stakeholders and how those skills are very similar to mentorship and being a mentor to other junior staff? How do you tailor those skills of mentorship and negotiation in the international public health arena?
Yeah, so I think, the two big skills that come to mind when we talk about mentorship and negotiation is listening. And Zia talked a little bit about this, truly hearing what people are saying, whether that's a community we're serving or a donor that we're negotiating funding with. You really have to be a good listener and putting aside your bias, because that can often hamper our listening skills. And also fostering. I think one of the things that is really important is being able to bring out the best in others, whether it's the party that you're negotiating with or it's someone that you're mentoring, and really creating a sort of we've talked about growth mindset, but sort of a solution mindset. It's so easy to focus on the problem and not on a solution. And so flipping the coin around. I was reflecting on this, and I think at my time at Rollins, one of the classes that I hated the most, but it's probably been one of the most beneficial, was my organizational change management class. Because one of the things in that class was about mapping the key players and really understanding who you're dealing with, where they're coming from, why they may have the position that they have. And that's relevant for if you're mentoring someone or you're negotiating with someone. What's their role? What should they be doing? What could they be doing? What would they like to do? And then really fostering them. So I think just knowing who you're dealing with and truly listening and understanding them is really, really critical, especially in international public health.
Those are such important key takeaways. When you think about being a mentor or, in your role, like working with key stakeholders, as you're listening, you're building others up as you're mentoring, and by lifting others up and showing people what their potential is and understanding the dynamics in the room, it all helps, whether you're in the middle of a pandemic and, trying to get your response team to achieve a goal, or, whether you're working with an organization and trying to get funding to continue your projects. You all have an endpoint in mind, and each of the different aspects that you pinpointed and highlighted are such important pieces to pulling together all of this information. And so thank you for highlighting that. And I want to move to the next question and open it up to any of the three of you. Are you willing to share a risk or a key lesson that you've taken during your career path that has either worked out really well or that maybe didn't work out the way you planned, but you've learned an essential lesson from? So I'm going to open up the floor to any of the three of you.
I can go first on that, if that's okay. Yeah, I think one of the most important risks that I've taken in life was a little bit of background to that. I'm the first physician in my family, and just I guess how in the South Asian culture, being physician is the best thing that you can ever do, and it was literally the dream of my father and grandfather and just my whole extended family, which was awesome. Just getting into a really prestigious medical institute in Pakistan, Nishtar Medical College, it was a really good experience. But then once I graduated, I wanted to go into the public health. I wanted to explore what's out there, how we come up with all the figures that are written in the medical books. But I think there was a huge risk to that because it's a very non-traditional pathway, especially here in this part of the world. Most people go straight into the clinical, they want to be, they want to be cardiologists, neurologists, practice medicine. So the interesting term, to be, but I mean, that took me to Rollins, and that took me to so many great places. I met so many people that have mentored me. I've learned so much throughout this time, and I would not do it any other way. If I were given the chance, I would choose this over and over again. So I think for me it worked out well.
Thank you. Yeah, it's so great to hear about those challenges and, how you just maximize the opportunities. Heather?
I think for me, one of the biggest sort of risks that I've taken in my professional career is when you were introducing me, you said, external relations, international relations, public health, and that seems like it fits together. And then there's this gender piece. And so how did an external relations officer, health policy and management person end up doing gender? And to be frankly honest, it was sort of by accident, because the donors said, if you don't embrace gender as a immunization program in polio, we're not going to fund you anymore. And so all of the managers looked at me and said, well, you're the external relations officer, fix this. So I ended up going, okay, what am I going to do? We have $1 billion budget and it's, hanging over my head. And so it actually forced me, I had to go and I took classes and did a 6-month deep dive on organizational change management for gender mainstreaming, and really had to push myself to embrace a whole new area of work, which was actually one of the best things that's ever happened to me. And so it worked out well. I was able to take a lot of my experience from, my public health knowledge from Rollins, and my external relations, international relations background, and sort of bring that to gender mainstreaming. So I'm not a gender specialist per se, but I'm a mainstreaming specialist. How do you integrate a new area of work into a public health program? And so, I was pushed to the brink, really tested my limits, but I have to say, 7 years on, that was one of the best things that ever happened to me.
Wow. And what an incredible opportunity for you to just run with it and grow in your skill set and take additional courses and really take up that challenge. Thank you for sharing that.
I was incredibly supported by my directors and my bosses. And I have to say, that's so important in your career journey, that you find those mentors who can help you spread your wings to fly. It may not always be your direct boss. It may be, somebody else on the side who encourages you and helps you leave the nest, but they're out there, and it's really amazing when you can take advantage of it.
100% agree. It's interesting because I think sometimes we're so focused on doing a specific subject matter upon graduation or during our career. And, as you're interviewing and looking at different jobs or mid-career changes, it's who you're working with that really can help develop you as a professional. And, as you're talking with potential employers, you've just really hit on some key points in terms of looking for people who want to help you grow as a professional and who support your interests and are willing to let you take challenges and risks and, have those professional development opportunities is really, I think, what can make a career satisfying. Marina, would you like to talk about a specific risk or challenge throughout your career?
Yes, of course. I was thinking about it, and for us, the biggest challenge was like move out to the country. We were settled in the US, and a position came up in Argentina, and it was a family decision. My husband also does research, so it was a position for both of us in the same institution. And we need to decide if we take the risk and we move all the way south, and something that we always dream as a family, returning to our roots. Our extended family is here. So at first, the idea of becoming a professor seemed daunting to me, but I spent more time on the role. I came to appreciate the rewards of teaching and forming connection with my students. So I think it was worth it, the risk of say, okay, let's move out south and see what's happening.
Thank you. That's great.
So we have one final formal question for you all, but we also want to acknowledge and thank all the people who have joined our session today. And so we want to make sure if any of you listening have any questions that you'd like to ask our colleagues, to please put them in the chat. We want to hear from you. We want to make sure that if you have burning questions that you'd love to get their insights and perspectives on, that we have a chance to get them. So if you just want to put them in the chat, we'll make sure to get them addressed. So one of the final question that we have for you all is, we hear from a lot of students as well as alumni. They're curious about how to work outside of the U.S. in the field of public health. So we're curious, as you reflect on the classes that you took at Rollins, the experiences, as Dr. Zia mentioned, a lot of the different organizations and groups that he was able to connect with while at Rollins. What advice do you have on courses or experiences to seek out while you're at Rollins?
Well, let me start. I think it's like we talked before, and in this conversation, like networking. I think networking is something a key, and talking with professors, and you have different leaders and experts in different fields. And I wish I talked more with them, and I did. And I was trained with Dr. Mo and Dr. Leon in epidemiology, but I wish I talked more and I reached with more professors and networking. And you have a lot of opportunities to do practicum experience in the US and outside. And I think it's a great value for Rollins that it has.
Thanks, Marina. Others? Heather, Dr. Zia?
Yeah, for me, I would say there's three areas, and I'll go into a little: gender, field opportunities, and finance. And I say gender, if there's any gender courses at Rollins, I haven't looked at your curriculum in quite some time, but I think it's really, really important for the future of public health that students gain knowledge and an appreciation of how gender is affecting public health outcomes. We've kind of are a bit stagnant in some areas of public health. I can think of immunization as an example. And if we really want to affect change and see improvements in outcomes, we need to start looking at gender. Second would be field opportunities. I think there is such a desperate need for innovation, and there's so many guidelines and policies, and they just sit on a shelf because the challenge is really lies in implementing those policies, and they cannot just be implemented blanket. It really involves you going to community level and focusing on what do the communities need. And so you're going to actually achieve better and improved health outcomes at a community level. And it's not one person at a time, it's sort of one community at a time. And I think having experience at the field level, community level is only going to enhance your ability in the international arena to really start to be a part of affecting public health outcomes. And the last one is finance. I think it's been my experience after 2 decades of working in this area, so many public health experts cannot budget or manage a budget. And many well-funded public health projects fail because of poor project management really linked to money. And I cannot underscore enough that, if you want to have money to fund your project, you need to be able to not only articulate what you want to achieve, but how you're going to use that money to achieve it, and then see it all the way through, that you're really allocating the resources appropriately. They're accounting for the resources appropriately, because that's so critical in the international public health world. I can't speak so much for the United States, but internationally, it just time and time again, whether you're with WHO or UNICEF or any of the other big international NGOs or UN agencies, if you cannot do finance, you will really struggle in delivering public health programming to communities.
Thanks, Heather. I'm sure a lot of the key partners and donors that you've worked with in your external relations, you have to understand the business speak. And I think as uncomfortable as that can often make us in public health, I think that's being able to have shared language, I think is really important. So thanks for flagging that. Dr. Zia?
Yeah, I mean, it's a very tough question for me because I graduated, relatively recently, and there's so many classes, there's so many professors that I loved, getting mentored by. I would say, I think, in terms of the global health, I think, the global, field award is like, something that, people can pursue. And, I think, just I would encourage not limiting yourself just to just go through the GFE award. Even if you don't get it, there's so many other opportunities. Sometimes there are emails that are sent into the inbox, and if you go through that, there are some professors, they're working on something that you can reach out to them, and sometimes things open up. And there was one class that I really loved, which was the introduction to social entrepreneurship. It was a 1-credit course, but it was hands-on. It was very informative. It was taught by Dr. Schrader. And I think if I could just short it down to like, even if it's tough, but like to one class that was really good. It was EPI 553, which is writing and presenting epidemiological research. I think epidemiological research ethics are something that is like, just very important. And it was taught by, one of the best professors at Rollins and one of the best people that I've ever met in my life, Dr. Cecile Jensen's. Actually, they passed away like recently due to leukemia. So I'm not sure like if the class is being offered anymore, but that was a really good experience that I gained through that.
Thanks, Dr. Z, and thanks all for sharing. I think, we talked a lot about networking and connecting with professors, and I think I can't underscore enough that I think taking the time to build the networks with the people that are sitting to your right and to your left in your classes as well, creating that community, because I can't count the number of times where in my day-to-day work, I've called up a Rollins alum or a classmate, and that has resulted in incredible partnerships globally. So I think taking the time to invest in your classmates and your colleagues as well, I think is an incredible network, and one for which I think is really great at Rollins. So we've got some really great questions. So Amy, Elena, do you want to read the questions as they're coming in?
Yes, and we also have a hand raised, I see, but let me start with this question in the chat. It says, thank you everyone for sharing your stories of inspiration and resilience. I would like to know if when seeking jobs in a new city, it's better to look for jobs that are at an entry level and easier to acquire, or seek more senior positions that match my years of experience but are harder to acquire.
Ooh, that's a tough one. I'm actually a mid-career professional, sort of trying to figure that one out myself. And I think that would be, you'd have to take a look. My take on that was you'd have to really look at, do you want to have a new experience, or do you want to and sort of pivot into a different area of work, or do you want to continue in the same area of work? I think you have to weigh which one you want. And I think when you're a mid-career professional, you can be a bit exhausted. You've done 20, 25 years of a certain area, and maybe you would really like to embrace something new. So it's going to be your decades of work experience that will get you the interview for maybe a more junior position, but in a completely different area of work. And so you just, again, it goes back to the risk. What kind of risk? If your family or your personal situation allows you to take it, I think all three panelists today, we've said take it, because it will pay off in dividends in the end.
That's a really good segue. I think the next question resonates with me because it is, how do you know what you want to do after graduating? And as an early career professional myself, I've always asked, what's your 5-year plan, Elena? What are you going to do next? And I think what you guys have shared is that it's not necessarily what, like, I'm going to go to the WHO, or I'm going to be a senior project manager. It's who are you working with? Who are you going to become? More of that, soft skills that kind of filled out your opportunity. But in particular, before you guys answer, something I wanted to underline from the question in the chat is the worry that their country may not have their interest study as much as if they were in a different country. So how do you kind of, coming from a global perspective, what are y'all's advice?
Well, if you let me start, and for example, I experienced that I have so much training in water research, and my dream job was coming back to Argentina to do water research, and I interviewed for a position, but finally I couldn't get it, and that was fine. And finally, I'm teaching, I'm doing something else, but it's rewarding also, and I have all the skills to build on that. So you can have a dream job, you can have an area that you like, but something else with your expertise and with your background, you are able to do it too. And it's okay too. It's in public health. So I think I can work in a different country.
Yeah, I would like to add on that. I think just in terms of like, just discovering like what you like, sometimes you have to put yourself out there and to see what things are like, and sometimes things are more interesting than they just look from like outside. And also, I would agree with what Marina said. I think I have always wanted to work on my own country in Pakistan, and like for the people of Pakistan, for the population in Pakistan. But there was a time after Rollins that I did not get any credible opportunity to work there. But then I took the opportunity to go to Egypt to work there. But I feel like there were so many things in common. There are so many things in common between the culture of the two countries, and I feel like I'm serving my own country because the problems are the same, the diseases are the same, and the experience I gained from there, even if it's not in Pakistan, but like it is something that I feel like it's rewarding, and it's I'm doing a meaningful contribution.
Thanks for the feedback and for the questions. If there's other questions, please put them in the chat, but we'd love to go to Lindsay. Do you want to come off of mute and ask your question?
Sorry, can I just build a little bit off of that? Especially,
Sure.
Many Rollins International Public Health students, they'll go have a field opportunity and then they go back to the United States and like, oh, I had this great opportunity and I can't continue to work outside of the US. But, we have to look at America there are many pockets of underserved communities that represent different countries. And, some of our communities, immigrant communities in America, have morbidity and mortality statistics that rival some of the bottom 5% of countries in the world. And I think, if you're able to have an international field experience, even if it's time limited, it will be so invaluable when you come back to the United States to work with these types of communities that are so underserved. And so I think, we don't always have to look at, for the longer term, I want to work outside of the United States. But really, if I've had an experience outside of the US, how can I bring that home and really help the communities that are even in my home country?
Absolutely. Thanks, Heather. It's important. Lindsay, over to you.
Thank you everyone so much for your wonderful answers to these questions. It's really helpful. I'm actually a recent graduate. I graduated last year in 22, and I am now living in Kenya pursuing a Fulbright. So I know that two of you guys were Fulbright scholars. And as somebody that is working abroad already, so I'm kind of on the flip side of the last question, somebody that's working abroad already, you guys have emphasized this concept of needing to network and needing to have good mentors. But in today's landscape, it looks very different than it did 4 years ago when you were sitting beside someone at meetings and you could have these kind of extracurricular conversations about, things pertaining to work or even outside of work. And nowadays it's much more, you need to be purposeful with your time to make those connections. I was wondering if you have seen kind of a shift in mentorship styles and or how to gain those mentors, because I will say that I started my time at Rollins in the fall of 2020, and it was really, really difficult to find mentors. And I think that all of my peers agreed with that. I don't think many of us came out of Rollins with really solid mentors, especially if we didn't want to go into academia, because we're working with professors that are in academia and don't necessarily know a ton of outside, I guess like a ton of the landscape outside of academia. So I was wondering if you had advice on any of that.
I think you're the generation that social network and you have tons of apps or stuff that can help, and don't be afraid to contact them and to say, this is my situation. What can I do with this? And can you help me? And personally, for example, this panel, I had the opportunity because I reached out before last year for another question to Molly, and then this came up. And so there are opportunities when you reach out to people, and don't be afraid and reach out to those people.
Yeah, I would probably say that, and I totally get that, how difficult it is. I mean, in my area of work, external relations, it's all about networking. And so, you know, all my donors, nobody could travel anymore. There were no more meetings with UN missions. And so how do you keep up those networks, especially the informal networks, where you can say things that you couldn't write in an email or say over the phone? I think maybe you have to make more of an investment in one person, finding that one person who might have a few people, and then those few people have another few people. It's just, you know, it's not, you're not going to the cocktail party or the barbecue in Nairobi. You have to find that one person. And I think Rollins, I think really looking at, I know that there's some mentoring opportunities through the Rollins alum system, and maybe having to lean more on grads from 10 years ago or 15 or 20 years ago, and really looking at Rollins to help foster maybe that one person who can help you, branch out a bit more. I totally feel your pain because it is in a post-COVID world, it's so very challenging to network. And even though some people are at the office, not everyone is at the office. And even though you have some meetings, you're not having the meetings frequently enough to really establish networks.
Yeah, we are a community. So please feel free, everyone, to connect with us afterwards. This was incredible. I just want to be respectful of our time, as this panel does end at 9 a.m. Eastern. So that was a great discussion. Thanks everyone for your questions. Thank you guys so much, Dr. Zia, Marina, and Heather for joining. And that concludes our panel discussion for today.
I see a quick question from Lindsay around the panelist email. So maybe just quickly, if the panelists are willing to put their emails in the chat, if there's any other follow-up questions that people have, please feel free to put them in there.
And there's also a Mentor Rollins opportunity. I don't know if Michelle or Sam want to jump on camera for a moment and just mention that.
Yes, this is Sam Ramasova. I'm with the Office of Career Development. Yeah, we do have Mentor Rollins. It's a wonderful opportunity where you can meet a lot of our alumni and non-alumni who are mentors and who can guide you in the process on figuring out what direction you want to take in terms of your career choices.
Thank you.
And I'll just also add a little plug from the alumni office. Hi, everyone. I'm Michelle James. I'm the alumni director at Rollins. We work very closely with our good friends in career development. And we have an alumni directory. We have Emory Connects. We have lots of different platforms in addition to Mentor Rollins for more informal connections. We're on social media. We're on LinkedIn and Facebook and Instagram. And so please reach out to us. There are resources to help connect you initially and keep you connected. And of course, we hold lots of events and activities and great programs like this so you can meet people around the world.
Thank you all. That concludes today's session.
Thank you for the invitation.
Thank you.
Thanks, everyone.
Thank you for the opportunity. Yeah.